Welcome back, folks. So what I thought I would do is I'm going to show you a few bits and pieces that you might come across in a first aid kit or maybe in somebody's house. First of all, when we did the head to toe check, you might come across somebody who's got medical ID, medical alert, SOS talisman, etc. So that would indicate that they suffer from a condition. They can come in many different formats, okay, different emblems, different icons, etc., etc. You also, you might come across somebody who's got this, and this is called an ICE card, in case of emergency card, okay? And it's got a medical alert, and on the back, I've filled this in with my details. It's just the details there of who might this belong to, their doctor's surgery, etc. So what the conditions they suffer from. So there's that one. We've also got inhalers here, okay? Now, generally, most people will have this prescribed for their needs. So these are not interchangeable. These are not things which people can use for somebody else's. You need to use your own inhaler. And the person themselves has the dose already on there. These are relievers. So therefore, these are ones which can be used fairly frequently if somebody's suffering from a bout of asthma. But if there's other colours they maybe need to take, these are called preventers, and they tend to be purple, orange, brown, other ones there. Okay, we've got another couple of things here, not least. These are called Jex pens, and these are basically EpiPens. The EpiPens are prescribed to the individual. These two have got yellow tops on, and that signifies it's for an adult. Different colours for different age groups, different body masses. The person has to use this themselves. So essentially, I'm just going to ask Sasha to step back. I'm just going to demonstrate this. So the person should take this from the top, and it's now charged, and then they put it into their thigh, higher up probably, buttock, or even arm. Okay? Essentially, that is the dose that they require for their specific needs. So these are not interchangeable either. What happens to this when it's been used? It gets thrown away, okay? Thrown away or put into a sharps bin or taken with the person to the doctor or in the ambulance. That way they can see which particular medication this person has had, okay? The person themselves should take it, you shouldn't administer it unless you've been trained. Could also be that maybe somebody's got one of these. Now I've taken the needle off of this, but this is basically an insulin pen. If you come in closer, you see there's a dial on here. This one's empty, but basically what can be that they can set the dial to the particular dose they require, having checked their sugar level, and then they can then just take that. And that is administered into the stomach, left or right of the actual belly button. It shouldn't go anywhere else. Near the belly button, and it's there as opposed to an insulin pen which goes into the thigh, buttock or arm. But you should be given specific training on diabetes or epilepsy. Another thing which might be useful for you in a first aid kit is a thermometer. The dangerous temperatures can be 38 degrees and above. Okay, some people say 37.5, but 38. If somebody's got a temperature of that, then you need some intervention, some help. Okay. If somebody burns themselves, obviously water is best. 10 minutes to cool down a burn. Don't put cling film on until the heat is out. But yes, it's a good thing to put on because ultimately it doesn't stick. But this is called Burn Soothe. It's a commercial grade soothing pack, which you open it up. I'm not going to open up, this is just a sample. And you just push this against the burn, whatever it is on the body, on the hand, whatever. And it sucks all the heat out, but doesn't allow it to drop back in again. So that's something you could use there. If you come across somebody's digit on the floor, I'm going to drop that on the floor, and you think, oh my goodness me, what you'd have to do is you'd have to make sure that you deal with the person first, obviously, pick that up with gloves, put it on ice, but make sure you wrap it first in cling film, and then take it with them. Put an identification mark, just in case the person and the person's thumb gets sort of estranged in any way, so you can know whose it is. So I'm just going to pick that back up. Bandages. Bandages obviously come in different sizes. They would normally be in an actual packet. The bandages, just roll them out, and then you put it over the wound, tie it around as tight as you possibly can. It's important you put it on as tight as you possibly can, because if it's on too slack, then it won't apply the direct pressure. Okay. If you come across somebody who's needing a sling, a triangular bandage can be used to put that on. The best way to describe this is to you just get a knot into the corner of the triangle, and you would put it over. Okay, so I'm just actually going to ask Sasha to put the phone down for the time being. Okay, so you put the phone down just a minute, and I'll just put this on. Okay, just quickly. So we're just going to be with you in a second. There's only the two of us here, so we can't film this being done, but this is the end result you're looking for. I'm just going to pick the phone back up. So this is the end result you're looking for. So there's a knot there, which then keeps that in place. Okay, so I'm going to give this back to Sasha, take the bandage off. Okay. All right, so that basically is as near the finish of our first aid training. Just to recap on a number of things, if we look up the flip chart, one thing I didn't touch upon was a stroke. If somebody's having a stroke, then they'll have a facial weakness down one side. The arms will not be able to, the muscle power to raise up. Their speech will be slurred or a lopsided smile, and they won't be able to put their tongue out straight. If you ask somebody who's in a stroke situation to put their tongue out, it either doesn't come out, so it sticks at the back of the throat, or it goes to the left or right. They can't stick it out straight, traditional sticking the tongue out. So that's a fairly new sign. And then time to call 999 or 112. Okay. I can't stress enough, especially in these times that we're living just now, infection control. So just be careful about any body fluids, phlegm, spittles, anything at all which might be coming, any coughing coming out of anybody's mouth. So remember to wash your hands, wear gloves at all times, use a face shield if you have one, watch out for any other body fluids, and wash your hands afterwards. If you think you've got somebody's infected blood into your bloodstream, you need to get yourself checked out. Check your tetanus, check your hepatitis, make sure that you're getting yourself checked out. Next one, we're nearly done. Be extra vigilant with hand hygiene and body fluid. Remember, concentrate on chest compressions. 80% of CPR is the chest compressions, not the breaths. So use a pocket mask. Okay. Remember, if somebody's fallen, you don't move them because you could damage them even further. So we look up here, we do the 3 Bs. The 3 Bs, breathing, bleeding, broken bones. Then you do the head to toe check, wearing gloves. Don't move them until they've been checked, and consider safety at all times. Okay? The next one, if somebody is bleeding, wear gloves. Stem the flow of blood with a bandage or something clean. You put one bandage on and then another one. If it's still not stemmed the flow of blood, you then take them off. You need to use what's called a hemostatic dressing or use a tourniquet. Now, one last thing just with regards to bleeding is this. Okay, so this is a tourniquet, but this is an adjustable tourniquet which you can put it round somebody's limb and then you can tighten it through the hand here. But also you've got this, it's not been released from the last time. Give me a second. Okay, then you just tighten that even tighter, but you can release this. The problem with a lot of these things is that they're not adjustable. So if you put a belt or a rope or anything else around, and people can cut off the circulation, but this one is adjustable. Okay, so you can use a tourniquet. If not, stop bleeding within 10 minutes, call for help. With regard to head injuries, look out for synovial fluid. This is the sort of yellow fluid that surrounds the brain. It might come out of the ears or the nose. Watch out for blue lips, blue cheeks. Watch out for blood coming out. Watch for the pupil size. Okay, the pupil size, that's a clear indication. Okay. So, we're now at the end of our last stage of a first aid. Just remember to always work as being trained. Make sure you get advice. If you're in any doubt in a casualty situation, call for help. Yes, by all means, phone 111 for advice, but if you need an ambulance, please use the emergency numbers we've showed you at the beginning, which were 999, 112, or if you're so Americanized that you might want to use 911. Can I thank you very much for your attention. Hopefully you never have to use any of the skills taught. I wish you good luck and thanks very much.